Hi, I'm Kelley McBride.
And I'm Ava Wright.
We're with the Madison County Health Department, and we're here to share with you how the census information impacts efforts to improve public health. Census information influences policies and practices that protect the quality of our air, water, and food, and the policies that provide local health education and health services.
The census results will inform how hundreds of billions of dollars in federal funding are allocated to more than 100 programs: Medicaid, Head Start, block grants for community mental health services, and the Supplemental Nutrition Assistance Program, also known as SNAP.
Your efforts can make a difference in our local community for the next decade. Fill out the 2020 census today.
We've been counted. Have you?
To get counted, take the 2020 census at my2020census.gov.
I'm Randy at Madison County Live. Be sure to watch our weather radar and forecast every morning at 6:30 Monday through Friday. And we'll post weather updates throughout the weekend. Get notified for all of your good news through our Facebook page or YouTube channel. Just search Madison County Live. While you're there, be sure to hit that follow button right under our cover photo and select See Us First so you can get notified when we put up a new post or video. Thank you for supporting Madison County Live and Good News. We produce, promote, and share happy.
Madison County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net, digital media services from top-of-the-line video production to live streaming services. Enjoy the show.
Colleen, you look gorgeous.
Well, thank you, Randy Rosenbaum. That's very kind of you. And you look quite derby dapper yourself.
Ooh, derby dapper. If we just had a derby.
Well, we are staying healthy at home, but it will always be Derby Day in my heart. So we have a great show coming up for you tonight.
Yes, we do.
Randy Rosenbaum. We have Cheryl Muncy, who is the founder of Newfangled Clothing. She's going to tell us all about how she reconfigured her business, and she is making amazing masks for our community. We have Gerard, who is the president of Baptist Health Richmond. He has a wonderful message of gratitude and thanks. You are not going to want to miss that. And of course, our friend Kelley McBride from the Madison County Health Department will be giving us, as always, incredibly useful information during this time.
Absolutely. And my favorite, poll results. Chicken
Result.
Or pizza.
Listen, speaking of delicious food, we'll have an update from Scott Anderson from the Madison County Food Services Department. You will not believe the number of meals that they have served here in Madison. It is amazing.
Wow.
That and more coming up.
Coming up.
Are you ready?
Are we ready? Wait a minute. Hold on. Wait a minute. Is that the call to the post?
Is that what that was?
No, maybe not.
It was that or Blue's Clues.
That's more like Blue's Clues.
Okay. Ready? Let's roll it.
Let's hit it.
You're watching Madison County Live.
Welcome, everyone, to Madison County Live. We are so happy to be with you this evening, aren't we, Randy Rosenbaum?
Yes, we are. Look, we even got dressed up for Derby, even though it's in September.
maybe.
Derby Day.
Derby
The
Day.
first Saturday in May. That is
Right.
what we got dressed for.
Yes.
And it's a gorgeous day. It's been a gorgeous day.
It has been.
So
It's been wonderful.
loving
How's
the
your
blue
How's
sky.
your week been? How's your week been?
I've had a very nice week. Thank you, Randy. Had a nice week. A nice, healthy at home week.
I think somebody fixed you something special at home, didn't they?
Absolutely. My sweet Hadley fixed homemade banana and blueberry pancakes.
Wow.
They were
That's
amazing.
great.
I got an immediate message from you. And what did it say?
Where's mine?
It said, Hadley, bring me some.
She didn't make it. She got lost.
That's right. She didn't. You weren't. You were on her route, but they were.
Correct.
They were always fun to have little treats like that. How about you, Randy? How's your week been?
It's been rather hectic and busy, really. I mean, yeah, doing a lot at Jack Burford Chevrolet. We're still in cars like candy bars, and a lot of online sales, and of course we're open for service. So that's kept me busy. Samantha and I have been shooting some tourism stuff. I've been doing some special projects for the fire department, and so it's really been a busy week.
That's good. That's good. So, have you been cooking this week, or did you get?
I have been cooking, not as much. It's been simple meals like chicken Alfredo, grilled cheese sandwiches. And do you like grilled cheese sandwiches with slice of tomato in your grilled cheese?
Yes, I love it that
Okay,
way.
good. That's the way I make mine. And Friday night we ordered catfish at Cooper's. So that was
Very
cool.
good.
So that's good. So
So
Cooper's for the win. Yep.
Very
Where'd you eat this week? Do you eat out anywhere or eat in anywhere?
We're eating in. We're cooking at home. We're staying healthy at home,
Cool.
and so just a lot of our favorites. A lot of tacos and salad, big salads,
pancakes.
making salad, pancakes, spaghetti.
Speaking of food,
Yes.
Scott Anderson.
I know. I love to pause with you sometimes because you do that with me so often. I love to trip you up every once in a while. Yes.
This could be
Scott,
the best show ever.
going to be something. Yes. And I wish you could see the number of cats that just did a parade across my front lawn. So I'm not sure.
Somebody's birthday?
No. Well, I mean, it's
Cat
funny. I'm not sure. They just all walked across like our
Really?
studio audience.
Oh,
So we have really enjoyed being able to share the good news that Scott Anderson and his entire Madison
Right.
Co Food Service has been providing meals to our families here in Madison County every week. I'm just astounded at the numbers. So here we are. We'd love to update you. First of all, I'd like to say that, Randy, I don't know if you saw the photos. I know we threw them up to our viewers, but Make Your Own Pizza Day was a hit.
oh, that's what I heard.
That looked absolutely delicious, and I think the kids loved it.
That's what I heard. That's what I heard.
A lot of fun with Make Your Own Pizza Day. This week's total number of meals served in Madison County, 82,418.
Just this week?
This week, Randy, that is a total for this week.
That is a lot.
It is
of
just
meals.
amazing to think what it takes in the preparation and all the folks that it takes to provide that. So once
That
again,
is incredible.
you're doing just a phenomenal job. I have another number for you, though, a couple of numbers for you too, Randy.
What is it?
Totals for April. Are you ready?
Oh, is this huge?
This is huge. This is
What is
totals
it?
for April.
What is it?
They served 129,192 breakfasts and 1,990.
Wow. That is a lot. Oh
just
my
hard to wrap
gosh.
our
Now that's
heads
for
around.
is that how the whole month of April you said, right?
The month of April.
Month
That
of
was
April. Okay.
for the month of April.
Wow. That is incredible. That's a whole lot. That's for
Thank
sure.
you so much to Scott Anderson and the entire team at Madison County Food Service.
Yep. Yep. Absolutely. Wow. You know, speaking of food, you know our poll result, Colleen?
Yes.
Pizza or chicken? What do you think? What do you think that was, Colleen? If you just had to guess, what do you think that was?
If I had to guess,
Yeah, pizza or chicken?
Yeah. I'm going to stick with the pizza theme.
You think pizza? Is it
I'm going to stick with
pizza? Well,
yes.
we did the poll result, okay, and pizza. You are correct, which it was leading. That's for sure.
Okay.
And by what margin do you think it was?
Ooh, I don't know.
Come
I
on.
feel like it was close.
You think it was close?
I feel like it was a close. Was it
Take
close?
take a look at these numbers. I'm gonna let you announce them.
Pizza. Oh my gosh.
Not
See, that's why
even
else.
close.
Not even close. Pizza, 76%. Chicken, 24%.
Yep.
We have a runaway winner here,
Yep.
folks.
We sure do. And I'm thinking. I'm sure pizza probably ordered. They ordered chicken, and I'm thinking the picture I put up for fried chicken in the pan. Maybe that's what people were thinking. But again, we also had burgers were high on the list. A lot of burgers, a lot of comments, mad mushrooms, pizza, and grinders and stuff like that. So a lot of people mention that.
Listen, I think the burgers here in Madison County are some of the best I
They
have
are.
ever had.
They're fantastic.
Best I have
Yep.
had. So, folks, continue to support your local small businesses.
Yes.
Curbside services are available in many cases, and I know that they
And
would
they'll
love to.
deliver right to your home, which is amazing.
Right to your home. Very
And
good.
and they'll give you the margaritas with your meal, which I find incredible.
I find that incredible too. Speaking of which,
Yep.
Cinco de Mayo is coming up this
It is. Is it this week
I
already?
think it's the Tuesday.
It might
we
be.
were
Wow.
going to talk about that
Cinco de Mayo.
through that.
You just threw that at me, Colleen. I write that
I
down.
did. I threw it on your schedule. I believe it is this Tuesday,
Wow.
May the 5th. So
Wow.
maybe enjoy those margaritas. And I've heard the sangrias have been
So the
delicious.
sangria's been popular. Yeah. Yeah. Wow. I find that incredible. That is fantastic. So we had a bunch of interviews this week.
We did. We are
And the
very,
first one was Cheryl Muncy, which is a good friend of yours.
She sure is. Cheryl is the creative director and owner of Newfangled Clothing, and that is a local small business that had to actually chose to make a complete pivot in their business
Sure.
to serve not only our Madison County community, but communities across the country. So are we ready?
Yes, we're ready. Let's roll it.
Let's hear from Cheryl.
All right.
Folks, welcome back. We are delighted to have Cheryl Muncy, who is the owner and creative designer for Newfangled Clothing. Cheryl, thank you for being with us tonight.
Thank you for having me. I'm so excited to be here. A little nervous too,
Yes.
but excited.
Well, we're thrilled to have you, and we know that you have been working day and night for several weeks now because you are providing handcrafted masks to folks, not just here in Madison County, but from what I've heard, all over the country. So tell us a little bit about Newfangled and what you're doing for our community.
Yes. Well, Newfangled is actually a children's brand of clothing that I design and create myself. But in the midst of all of this pandemic that has happened, we decided to shift a little bit because we were seeing so many people out there just who needed help, and we ourselves wanted to help and give back. So we started just kind of by our local Madison County Food Service here. We noticed that they were just providing food to all of the kids all over Madison County, and Madison County is not a small county. And I just wanted to help and to do my part and to, just help them in being safe while they delivered the food to all of our kids all across the county. And so I just reached out and asked if I could make masks for them. I've talked to, before I started it, I wanted to make sure that I had a good pattern. So I drafted my own pattern after talking to some healthcare professionals, including I have a friend who teaches nursing, and about what they needed, what they wanted, and what works the best. Doing some online research too. I looked at, there's some cancer groups that provide masks, just that they've always done it. So I just drafted a pattern and we went from there. We started with Madison County Foods is where we started at.
Wow.
And
So how do you choose the design? Are there patterns that people request, or do you have a generic mask, or who determines that?
Mask itself, it's one style. I've got one here. It's one actual, the actual style of it. Now you can change the fabric you can see on the front of it.
Yeah.
So this actual style here is what I created myself in order to, it's made to actually be, have less gaps in the face, so it actually, covers up the nose, and there's less gaps here, and it drops to the bottom of the chin. So the actual style is all the same for kids all the way up through men's sizes, but the outside of the pattern you can pick and choose based upon the fabrics I have available. Is kind of how that works.
Okay, nice. And I think what you were holding up was looked like a superhero pattern. Am I correct?
It's a female superhero. It's super popular. It's got Wonder Woman and Batgirl on it. So for the nurses, these have been because that's kind of been the theme of this whole thing. Heroes. They're actually heroes.
Cool.
So that,
And you have some beautiful, beautiful selections. And I know that you put new selections up and they go very, very quickly, right?
Yes, ma'am. They do. They do. They go. In the beginning, I started out just doing listings on Friday because I wanted to keep up. And there's so many people out there who are making masks as well. And I didn't want anybody to be waiting for more than a week to get one. That was my objective. So I put out what I could make in a week's time, and they would sell out in a couple of hours every Friday evening. Wow. And so now that it's got to the point to where everybody needs them, I keep a few of the fabrics that I just have in stock, like florals and solids. They stay in stock all week long, but the other ones, they update every Friday, and then new designs get updated every Friday as well.
Okay. So you mentioned earlier, how many thousands have you made?
I've made almost 4,000 at this point.
Wow.
Yeah. They're all handmade. They're go ahead. And they're all handmade. It's mostly me and my daughter and my son that do them, but there's 3 layers. There's the cotton on the outside of them, which is the design. It's 100% cotton, and then on the inside it's 100% flannel, and it's always solid. So therefore you have the difference. You know which side's going up against your face, kind of thing. And then on the inside, it has a barrier. It's actually the same material that's used in the surgical level mask that doctors use. So it's actually considered a PPE for protection.
Oh, that's neat.
And Cheryl, as a local small business owner, I know that you are also reaching out and partnering with our Madison County small businesses, because as we transition from healthy at home to healthy at work, those will be necessary to get back in business. So as folks are wanting to purchase masks, how can they find you?
They can find us directly through our website. That's kind of been the easiest. I just basically took our clothing brand and transitioned it over to a mask making. So they're listed on our website. It's newfangledclothing.com. They can get information there. They can always email me straight from there, and I try to respond to everybody in less than 24 hours, no matter what. That communication is very important to me. So I try to, give a response to everybody in less than 24 hours, but that's where they can reach me at.
That's cool.
And
that is really cool.
And Instagram as well, correct?
Yes, ma'am. Yes, ma'am.
Okay, so
it's Newfangled Clothing on both of them.
Very good. Well, Cheryl, we are so proud of you and so grateful for you. Thank you for providing, for meeting that need, and for finding a way to share your gift and your craft in such a meaningful way. We very, very much appreciate you, and again, all of the frontline heroes that are making this happen.
Yes, absolutely.
Thank you very much. Thank you very much. I'm just trying to do my part.
Oh, yes, absolutely. You do a lot. You do a lot.
You sure
Hey,
do.
Cheryl,
All right.
I did tell you. So what most people don't realize, I can see a wider shot, okay? And I noticed you have a guitar. Are you a musician too?
I wished. I'm DIY and crafty. I wish I was a musician.
So whose guitar?
Yes, it's my husband's guitar.
Okay.
Yes.
All right.
Yes,
Well,
I wish I was.
You got out easy because I was going to request that you play a tune.
I'm glad.
We can do that next time, Cheryl. Thank you so much. We very much appreciate you.
Thank you. Thank you very much for having me too.
Thank you for coming on.
All right, folks, we'll be right back.
Madison County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net. Digital media services from top-of-the-line video production to live streaming services. Now back to the show.
Hey everybody, welcome back. That is a fantastic task that she's doing. I mean, that's a lot of masks.
It's a lot of masks. They are beautiful. They are designed impeccably. So very good. We're very grateful to have in our community.
Yep. Our next interview is Greg Gerard, President, Baptist Health here in Richmond. And this is a little different interview because we had some technical difficulties, which we finally fixed. So we did a phone interview with Greg. And you'll notice that Colleen does not talk in this segment because she can't really hear Greg. It's just a conversation between Greg and I. So I know Colleen just sits there and she looks pretty.
I could hear Greg, but couldn't hear me.
Right.
I was thrilled to be able to hear your discussion. All right, are we ready?
Yes, let's roll it.
All right.
Welcome back, everybody. We have a special guest from Baptist Health Colleen, Greg. Hey, Greg, tell us how to pronounce your last name and what is your title there?
It's Gerard, Greg Gerard, and I'm certainly not that special, but I'm the president of Baptist Health Richmond.
All right, and I know you are doing a lot for the community, and I know this whole pandemic has really brought out the best in people, and I know that you really wanted to have a message for the healthcare professionals, first line responders, and the community.
Yeah, absolutely. I tell you, it's nothing like a crisis that brings out the best in your community and in people. And I'll tell you, it's just been overwhelming how blessed we've been with community support and just words of prayer and thoughts. And so it's just I mean, it's from the meals that have been delivered to the protective equipment that's been brought to us. It truly has been, inspiring and humbling in so many ways. And just last night, Faith Baptist Church provided meals to all our day shift staff and night shift staff, and I got to enjoy my Chick-fil-A sandwich while I was there that they provided to us. But just the outpouring from Tri-State Roofing and First Baptist Church and State Farm and just others in our community, I'd say probably in total 40 to 50 either individuals or companies have stepped up and just shown their love to Baptist Health Richmond and our staff. And it's just been truly I'm in awe of it, and it's just been so welcomed and so appreciative.
Well, that's fantastic, Greg. Tell us a little bit about Baptist Health and kind of what this time is like in the community during this pandemic.
Well, I tell you, it's just, obviously we're when you think of Baptist Health Richmond, you think of the hospital and patients coming to us that need to be admitted and so forth. And so, with the COVID crisis, it's still business as usual for us. We just have to manage another type of patient that comes through our doors. And fortunately, we've been so blessed in Madison County that we have not had the COVID virus as other states and other counties have. I mean, over the time of this crisis, we've admitted eight positive COVID patients that have all 7 of the 8 did fortunately go home and are recovering and have recovered. We did have one early on that did pass away, unfortunately. That was very tragic. But overall, our experience has been pretty minimal. I'm so thankful for that. The nursing homes have done a phenomenal job in trying to mitigate the virus, and they've done a great job so far. But for us, it's we continue to take care of those patients that have congestive heart failure and COPD, and we continue to still deliver babies as we always have. So it's still business as usual, but we just have to manage a little bit differently. We have to do a much better job at keeping our patients and staff safe. And so we've implemented all kinds of different measures to ensure our staff and patient safety, which are a little bit challenging and somewhat sad for some families that can't visit their loved ones. But we're just doing that truly in the spirit of utmost safety for our patients and staff, and then ultimately those family members they go back to.
True. Now, Greg, I know that you all have recommendations, and me as just a layperson in the community, what's the best thing I can do to help Baptist Health at this time?
And honestly, you've heard it all over across the country, and you heard it, you hear it every night from Governor Beshears too, is to stay home. Mm-hmm. And, don't get out unless you necessarily have to. And if you do, please wear a mask. And I know there's, some are reluctant to do that, but I know that, when I do go out, if it's either to work or to the grocery store, I have my mask on. So it's just continuing to be practice social distancing, continuing to wear your mask when you go out, and practicing hand hygiene. We can't emphasize that enough. In your own homes and when you're out, using hand sanitizer, etc. But just making sure that you're doing everything you can to prevent you spreading it, because that's the other thing is there's a lot of people walking around today. Unlike the flu, when you get the flu, you have the flu. Right. With COVID-19, you don't know. I mean, I could have it today and not be symptomatic, and then someone come into my house or I interact with someone, and Lord, they get it. And they feel it, and so that's the risk with COVID is you just don't know, and so again, just being safe and being cautious and just being patient, because I have a feeling, I'm hopeful that in the next month or so you're going to start to see the community open up, businesses open up, and let's get back to somewhat of a normal time that we had prior to COVID. Okay, Greg, what information that I may have forgot to mention or ask? No, I think that there's a couple of things that I wanted to leave you with today, and one is, by all means, the hospital, the ER is a safe place to come. Right. The one thing that we've seen across the country, and we've seen it locally too. Typically we'll have several patients present each month that are having a heart attack and need to go to the cath lab for intervention.
Sure.
And since COVID nationally, you've seen those numbers drop dramatically. So the fear is people they're more fearful of coming to the hospital that they're going to catch COVID, and they'd rather stay at home with those chest pains and everything. So my message today is for patients. We are safe, and I'll tell you, it's becoming a much safer facility, and the things that we're doing to disinfect and our staff taking precautions,
right.
It is a safe place to come if you need care. So please do not put off seeking care if you need it. The other thing that I would add and encourage people to do, because we've had so many people that have reached out, how can we help and what can we do? And the meals are fantastic. I can tell you our staff appreciate it, but there are the other ways. If we have the Baptist Health System has set up a COVID emergency assistance fund. So if you go to BaptistHealth.com, you can donate and help in this time of need, and help our employees, help our staff, help our patients in different ways. And so I would encourage people, if they want to give and have the means to do that, and they don't know how, to please go to the Baptist Health website, and it'll walk you through that. But and so those would be the two messages that I would leave with today. So
okay. Well, Greg, I want to thank you for coming on Madison County Live, Colleen and I. And if you have anything that you need to get out, make sure you contact us on our Facebook page.
Certainly will.
All right.
I certainly will. And listen, I sincerely appreciate you letting me come on this morning, and just know that we're going to get through this and going to be a much better and safer community for it. And so I'm never waste a crisis, and I think we're going to come out of this a much better community.
Absolutely. Hey, Greg, thanks for being with us today.
It's my pleasure. You all have a great Saturday afternoon. Take care.
We'll be right back after this, folks.
Hi, I'm Kelley McBride.
And I'm Ava Wright.
We're with the Madison County Health Department, and we're here to share with you how the census information impacts efforts to improve public health. Census information influences policies and practices that protect the quality of our air, water, and food, and the policies that provide local health education and health services.
The census results will inform how hundreds of billions of dollars in federal funding are allocated to more than 100 programs: Medicaid, Head Start, block grants for community mental health services, and the Supplemental Nutrition Assistance Program, also known as SNAP.
Your efforts can make a difference in our local community for the next decade. Fill out the 2020 census today.
We've been counted. Have you?
To get counted, take the 2020 census at my2020census.gov.
All right, very good. Thank you again to Greg Gerard, President of Baptist Health Richmond. They're just doing an amazing job, and
They
really,
sure
they just have so much gratitude. They have so much gratitude for the Madison County community and for everyone just helping out in so many different ways. So thank you very much to Greg for joining us. I'm sorry that I was not able to chime in.
That was the best interview ever.
Yes, it probably was Randy's favorite interview. But always thrilled to hear from
absolutely.
Baptist Health. All right, so we have another great interview with Kelley McBride, our friend from the Madison County Health Department. Madison County Health Department has been leading the charge, getting the information out to you need and when you need it. So always great to hear from Kelley. And are we ready for that, Randy?
Yes, we are. Let's roll that interview.
We are thrilled to have our friend Kelley McBride with the Madison County Health Department joining us again this evening. Kelley, thank you so much for being with us tonight.
You're welcome, and as always, I'm so happy for you guys to provide a platform for us to get out some of our messaging.
You're more than welcome. And what are you talking about tonight, Kelley?
Well, recently the governor announced that he wants to recommend for everyone to wear a mask out in public. Again, it's a recommendation. It's not going to be anything that's going to be heavily enforced, but it is a way for us to move from healthy at home to healthy at work. So this is going to take some time, But for us to continue our good hand washing habits and social distancing habits, and to add one more countermeasure to protection, this will help us get from healthy at home to healthy at work.
Right. Okay.
So Kelley, walk us through that.
Right. Now you can wear either a cloth mask, or if you have a different kind of mask, you can wear that as well. But the easiest thing to obtain would be probably one of the cloth masks. Now, we can make these ourselves. We can have friends or neighbors make those for us, because I know there are those talented people out there who can do that, and I've been fortunate to have some very sweet friends make some masks for me, so I appreciate that. There are two really good links that I want to promote. The cdc.gov link is always good. So there are guidelines on how to make a mask and how to wear a mask. And also something that we put out on our Facebook page is a LinkedIn article. And let me make sure I get the doctor's name right, but Dr. Peter Tippett. And it's called Saving Your Health One Mask at a Time. So please read that whole article. He goes into a lot of detail that will be very helpful. But a couple of things that I wanted to stress from that article was that he said any mask has three main protective properties. And one, it makes it difficult for you to touch your face, and because that's one of the biggest transmission factors that we have when you touch your hands to your face. So having that mask on is kind of that reminder of I don't need to touch my face. And then it also reduces the exposure to your nose and mouth to viruses or particles in the air. And then thirdly, it reduces your chance that others will get infected from you if you are sick and you don't know it, and vice versa. If you are sick, you need to stay home. So something that I thought he pointed out was really interesting, that when we drive our cars, we have seat belts and we have airbags. And so both of those things work together to reduce our risk of being hurt. And then on top of that, we have speed limits and signs and other protocols that we have to follow when we drive. So he explains how having a mask on, well, your nose reduces the particles that will get into your throat. We're just made that way. And then adding the mask to that reduces the particles getting into your nose. And beyond that, the social distancing will reduce the risk of particles getting to your mask or to yourself. So lots of good information there.
Well, now let me ask you a question. I had to go to the hardware store the other day, and I noticed at the checkout, they are selling masks, and they got different designs. I think this was camouflage. You know, so are those okay to buy? I mean,
yes. Actually, even if you make it yourself, the cloth, there are lots of different recommendations out there. And Dr. Tippett addressed this in his article, and he said, you know, you're welcome to spend a lot of money. You're welcome to you know, reach out to other people and have layers of filters inside your mask or whatever. But he really makes a great argument that just a cloth mask folded over, or cloth folded over several times, is going to be a good thing to wear, and to you don't have to spend all the fancy money, and you don't have to have something, you know, very expensive to do. It can be simple. Even the simple things will be a good protective barrier. So that's good to know.
Sure. Colleen, do we have our Madison County Live face mask in in transit? Do we have those?
Well, actually, yes, we're going to. So more on that, Kelley, and I think we'll have some more information on a local mask maker that we will be featuring.
Nice.
Yes.
Excellent.
Great.
Cool.
Oh, and I'm glad you mentioned that, because there have been reports of calls coming into emergency management and possibly the health department too. They are of people looking for masks from us, and we are not a resource, and neither is the emergency management agency. We're not resources for those masks. So until other possibilities, other avenues can be established, if ever, we are referring folks to the CDC website and the Kentucky COVID-19 website for videos of how to make a mask, how to wear the masks, and for there's videos, and then there's how-tos, written out instructions and directions on how to sew if you are so inclined. I don't know if did we mention this? It's important to have it over your nose and under your chin.
Yes. You want to talk more about that?
Well, I know that folks have been out in the public, and they'll see people with a mask hanging off of their ear, or they'll be working and they'll have them under their chin, and that's not going to provide anybody any protection. So we need to make sure that we have those on properly.
Right. Good. Now, and all of this is available on your website?
Yes.
And your Facebook page?
And I will, I will make sure you get those proper links.
Excellent.
So we can share that with everybody.
Fantastic.
Kelley, as always, thank you so much for this incredibly useful information from the Madison County Health Department. We appreciate you and your entire team keeping us safe and healthy at home, and as you say, a transition to be healthy at work.
Right.
All right. Thanks, guys.
Thank you.
All right. And folks, we'll be right back.
Hi, I'm Richmond Police Chief James Ebert, and I want to tell you why filling out the census form is very important. By filling out the census form, you can help your community thrive. Census numbers can help our community work out public improvement strategies for schools, traffic management, and senior citizens. It can also help during times of need. Did you know that many 911 emergency systems are based upon past census data? And it can help in making government work for you. It's a great way to tell our leaders who we are and what we need. The census helps determine the distribution of billions of dollars for hospitals, highways, and school lunch programs.
Hey everybody, I'm Assistant Fire Chief Richard Tate. The 2020 census numbers will also reduce risk for American businesses, like helping industries reduce financial risk and locate potential markets, and help businesses produce the products that you want. And census numbers help yourself and your family by helping you establish proof for age, residence, and information that could help you qualify for a pension, citizenship, or obtain an inheritance.
We've been counted. Have you?
Be sure to fill out the 2020 census today.
Get counted. Take the 2020 census at my2020census.gov.
Welcome back. Very nice to hear from Kelley McBride. Always information from the Madison County Health Department.
And they do a lot of work. I don't think people realize the behind the scenes stuff that they actually do.
Absolutely. Absolutely. Very, very grateful. So, Randy, it's been a week.
It has been a week. Always. It's always been a week.
Yes, it's been a week, but we are lucky to be healthy at home. We are very fortunate to be connecting with you, Madison County.
Right.
Favorite of our week, and we hope that you are continuing to stay healthy at home, and probably maybe having a few technical difficulties as well. Sure. I don't know if there is a time that people will see in this broadcast of Randy making some interesting motions behind the scenes.
See if you can see some things that happen that are unplanned. That, it happens. It happens with live stuff, right?
It does. It happens. But that's just part of it. And we know that so many of you are teaching virtually or working virtually. Yep. You're having some mishaps as well.
Yep.
And,
yep. You got to learn to roll with it in life. Valuable life lessons. Just roll with it.
Just learning to roll with it. All right, folks. Make it a great week. Thank you so much for joining us once again. Randy, who we'd like to thank this week?
Well, we got to thank everybody for coming on the show this week and agreeing to be on Madison County Live. And if you want to be on Madison County Live, shoot us a message on Facebook. That's really the easiest way to get a hold of us. I mean, we're always online, and you'll be able to watch the show always, of course, at every Saturday night at 8 o'clock, Sunday replays at 8 a.m. and 9 p.m. And, of course, it'll premiere on Saturday nights on Facebook and YouTube. And you can watch the segments throughout the week. We'll break those out through the week.
Absolutely.
Yep. And guess what we have? We're going to close with the Cain Pole fishing report. As always, Colleen, go ahead. Cast your line. Go.
No, it would be terrible.
No,
it's Derby. I'm sorry. I'm taking.
It's not real. Okay, there you go. I'm a trotter. I'm not really a galloper.
I love that, Randy. I love that. Folks, thanks for watching. Stay safe, and we'll see you again soon.
Happy Derby Day. My tie straight.
Your tie is straight.
Okay. Your head's crooked.
Listen. The fact that this thing stayed on our entire broadcast is a miracle.
Happy Derby Day.
Happy Derby Day. We'll see you again soon.
See you next week.
Madison County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net. Digital media services from top-of-the-line video production to live streaming services. Thanks for watching the show. Oh, there he is! There he is! Nice! Bad. Ricky Crooked.
No, I'm not.
That's what I'm talking about. Not a big one. There you go. Say nice. The weekly Kentucky Fish and Wildlife Fishing Report, brought to you by the Cain Pole in Southern Hills Plaza.
This is Marcy Anderson with the Fishing Report for Southeast Kentucky. On Lake Cumberland, water temperatures are in the mid-60s and lake levels are back on the rise after recent rains. Anglers have been having success catching striped bass using shad, so try targeting the main lake and midway up the major creeks, fishing from the surface down to 30 feet for your best chance at catching one. On the Cumberland tailwater, flows have been variable, which has provided better opportunities for anglers to get on the water. Dead shad and minnows have been productive for trout on the tailwater as of late. Don't overlook the tailwater for your chance to catch some nice striped bass and walleye during this time of year. Be sure to check out the generation schedule online to help plan your trip to avoid getting caught in rising water. On Dale Hollow, anglers have been having a fair amount of success catching black bass. Fishing live baits and swim baits has been producing some nice smallmouth. Try targeting main lake points and flats in 10 to 15 feet of water for them. Largemouth bass are up in the creeks around woody structure and have been hitting on soft plastics. Also been hearing some reports of walleye being caught on jerkbaits at night on Dale Hollow Lake and Laurel River Lake. Hope you can find some time to get out on the water. Be safe and good luck.
I'm Randy at Madison County Live. Be sure to watch our weather radar and forecast every morning at 6:30 Monday through Friday. And we'll post weather updates throughout the weekend. Get notified for all of your good news through our Facebook page or YouTube channel. Just search Madison County Live. While you're there, be sure to hit that follow button right under our cover photo and select See Us First so you can get notified when we put up a new post or video. Thank you for supporting Madison County Live and Good News. We produce, promote, and share happy.
Watch Madison County Live premieres on Facebook and YouTube every Saturday evening at 8 o'clock with replays at 8 a.m. and 9 p.m. on Sundays on Facebook. And of course, always throughout the week on the Madison County Live Facebook page.
Hi, I'm Richmond Police Chief James Ebert, and I want to tell you why filling out the census form is very important. By filling out the census form, you can help your community thrive. Census numbers can help our community work out public improvement strategies for schools, traffic management, and senior citizens. It can also help during times of need. Did you know that many 911 emergency systems are based upon past census data? And it can help in making government work for you. It's a great way to tell our leaders who we are and what we need. The census helps determine the distribution of billions of dollars for hospitals, highways, and school lunch programs.
Hey everybody, I'm Assistant Fire Chief Richard Tate. The 2020 census numbers will also reduce risk for American businesses, like helping industries reduce financial risk and locate potential markets and help businesses produce the products that you want. And census numbers help yourself and your family by helping you establish proof for age, residence, and information that could help you qualify for a pension, citizenship, or obtain an inheritance.
We've been counted. Have you?
Be sure to fill out the 2020 census today.
Get counted. Take the 2020 census at my2020census.gov.
The Madison County Health Department is asking for the public's help to reduce the spread of COVID-19 locally. Some familiar preventative measures that you can take include washing your hands often, avoiding close contact with people who are sick, and staying home if you are sick yourself, covering your cough or sneeze with a tissue, and then throwing the used tissue in the trash. Avoid touching your face and mouth with unwashed hands, keeping surfaces clean. The trusted sources of information in Kentucky are kycovid19.ky.gov, the Kentucky Hotline, 1-800-722-5725, your local health department, and the Centers for Disease Control and Prevention website, cdc.gov.
Hey, Colleen. The governor wants us to do a special promo to tell people to keep that 6-foot distancing space. And I'm calling it spatial distancing.
Spatial? Randy, it's social.
Spatial.
Social.
Spatial.
Special?
Spatial. Spatial.
Really, Randy? It's social.
Spatial.
I think there's one thing that we can agree on.
Okay.
Folks, please keep your distance. Correct, Randy?
6 feet.
6 feet or more.
6 feet or more.
To create that social distance you need to keep your friends and family safe.
Right. Spatial.
Right. Okay. We are doing it, and we know that you will too.
Do it. 6 feet.
6 feet.